the ideal way to lift something from the floor is to have feet planted about shoulder width. You bend your knees and hips such that when you go down to the floor to pick the item up, that your spine can remain as neutral as possible. For knee mobility, you could increase your knee flexibility by doing exercises such as quad stretch and hamstring stretch. If you have existing knee pain from a pre-existing knee injury, it is even more important to increase your knee mobility to prevent further injury. When it comes to lifting, the quads are supposed to do most of the work. If you don't have enough quad strength, then you tend to end up relying more on your back extensors, which is not ideal because that puts more pressure in the spine. To strengthen your quads, ideally you want to strengthen it in a way that is similar to how you're going to use it. Practicing your squats will be a very good idea. If you cannot do the squats with good form because of the lack of quad strength, you can practice sit to stand. Sit to stand is a great exercise for people who don't have enough quad strength to do a proper squat. You use very similar muscles as squats when you do a sit to stand. Hip mobility. If you have a lot of hip stiffness, then you still cannot lower your body close to the ground to do a proper squat, even if you can bend your knee all the way. It is important to increase your hip flexibility. You can increase your hip flexibility through a knee to chest stretch, glute stretch to release tension from your glutes, piriformis stretch to release tension in your deep hip rotators, hip flexor stretch to release tension in the anterior capsule of the hip. Even though there are many core exercises that you can do, you actually don't need anything fancy when you want to increase your core strength during sit to stand. And this is because you want the engagement to happen during specific positions, sit and stand. Now don't get me wrong, it is still important to activate your core during any positions if you have a pre-existing back pain, because most likely you will have pain in other positions too. So you will need to learn to engage your core in other positions. However, if you're only looking to prevent back pain or back injury when you're doing a lift, then you should just concentrate on engaging your core when you're doing lifting or lifting movements. First, practice engaging your core in a sitting position. So, sit in an upright position and then draw your navel slightly toward your spine. Keep that tension there and breathe. You can pretend that you want to make more room between your pants and your skin. Next, you want to keep that tension as you stand up. And this could take some practice. Once you've gotten used to this engagement of your core during the sit to stand movement, then you can practice the same thing during a squat. Except this time, since you're starting in the standing position, you will have to learn how to activate your core first in the standing position. The process is the same. Stand upright, feet shoulder width, and draw your navel toward your spine. And imagine that you're making space between your pants and your skin at the level of the waistline. Maintain that tension in your abdomen as you go into your squats, and then maintain that tension when you come back up with the weight, and maintain that tension as you come up from a squatting position to standing again. Now when you go from doing a squat to doing a weighted squat, which you should do when you're preparing yourself to lift something from the floor. To do a weighted squat, you will need some extra core engagement. Sometimes you could benefit from engaging your pelvic floor muscles to help you get that extra stabilization that you need when you're picking up something heavy. To engage your pelvic floor, simply tighten your sphincter. And this is because the sphincter is part of the pelvic floor. And since the sphincter muscles are voluntary, you can easily control your pelvic floor activation voluntarily by utilizing your sphincter muscles. So tighten your sphincter, and there you go. As you keep that tension, your pelvic floor is already engaged. Imagine that you're holding in either your pee or poo or gas. This way, your sphincter will engage and your pelvic floor is stabilized, and also helping you to stabilize your lumbar spine. When you do a weighted squat or lifting from something from the floor, simply tighten your sphincter as you pick up that heavy item. And don't release that tension until you're no longer holding that item.